Hello everyone, welcome to Shirika Elite Hospital podcast, where we bring trusted conversations on healthcare. I'm your host, Philista Zaudi, and today we have our guest, a speech therapist, who will take us through stuttering. Welcome to our podcast. Welcome, Daktari. Please introduce yourself.
Hi, I'm Dr. Mumo, a speech and language pathologist at Shirika Elite Hospital. Mm-hmm. Welcome.
We are looking at stammering today, and probably just to clear the air, is there really a difference between stammering and stuttering? Is it the same thing? It just depends on where we studied.
Okay. Yeah. By introduction, first, stammering or stuttering is more or less the same thing. Yeah?
All right.
The difference is it depends from which approach are you viewing it. Mm-hmm. Because stammering, the word stammering, it is a Breton word used in the UK. Mm-hmm. And stuttering, it's American English used in the USA. Mm-hmm. But they all more or less mean the same thing. It means disruption in the flow of speech. Mm-hmm. Any disruption in the normal smooth flow of speech, that is stammering or stuttering.
All right.
Yes.
So from where you sit as a specialist, it's the same thing?
It's the same thing.
Yeah.
It's the same thing.
From where we sit as laymen, it just depends on where we studied or what we prefer. Thing. All right. So would you please define for us stammering?
Stammering simply means in simple understandable language, stammering simply means disruption in flow of speech. These disruptions could be in form of blocks, prolongation, or repetition. What do I mean by this? By blocks, I mean you must have encountered a patient or a person who, let me use the word person, person who stammers.
Yes,
okay?
A lot.
And how they present is just that you've never been keen to understand or to categorize the kind of disruption. Let me give you an example of, your name is?
Audi.
Yeah. Patient with who stammers, I told they present with 3 classical presentation, blockage, prolongation, and repetition. So for your name, Audi, a patient who blocks or present with blockage, assuming I wanted to call you your name, Audi, you'll start and then blocks. The other syllables, you will not be able to pronounce them. That's one. There are those who present with repetition. Repetition of the first syllable. Audi. There are those who they present with prolongation. Audi. You see? Yeah. All those, they disrupt the normal flow of speech. Yes.
All right. So, do you classify stammering in any way? Is it classified?
There's classification. We classify it either mild, moderate, or severe. Okay? So there are those patients who come, they present with one presentation. Maybe they block, they don't prolong, they don't have repetition. So you don't turn them away. Those are classified as mild stuttering. There are those who present with 2 presentations, either blockage or blockage with repetition. That is moderate. And then severe stammering or severe stuttering, they must present with the 3. That is, they block, they prolong, and they have the repetitions.
All right.
Yes.
So if they only tick one box, it's a mild stammering.
Mild. Yes.
They tick 2 boxes of the 3, that's something intermediate, moderate.
Yes.
And then if they tick all the 3 boxes, then that's severe.
That's severe. Yeah. And all the categories, they have their own therapy approach.
All right. Yes. So it means we cannot manage a mild patient in the same way that we will manage a severe patient.
No. You manage mild. You manage each patient according to the category you have classified them after you have done your own assessment.
All right.
Yes.
And is it the category that a patient falls into, is it directly proportional to the period we expect to see change when we start therapy?
This is a rehabilitative service one. We don't give timelines.
All right.
Okay? This is not a curative service.
Okay.
In speech therapy, it is non-standardized approach. It is not standardized approach like curative. An example, if you present to me with malaria and another person present to me with malaria, the treatment is defined.
Yes.
But for speech therapies, it being a rehabilitative service, the prognosis or the timelines for the outcome, it depends on how an individual will respond. It is individualized therapy plan.
All right.
Yes.
Okay. I hope that is clear to our audience as well. So probably would you highlight to us what causes stammering?
Okay, ideally, there's no definitive cause of stammering because stammering is differences in processing, how the brain processes speech or information. Okay, what you have is risk factors. What are the risk factors that may predispose you to stuttering? One, and that is very common, it is family history or genetics. If there is that lineage in your family, maybe your uncle is stammering, your brother stammers, your sister stammers, your father, your mother, there is highly likelihood you will stammer. That's one. The other one is gender. It's more common in male than women. The other one is age onset. Stuttering starts from the age of 2 years to 6 years, but more common at 3.5 years. Yes.
All right. Come to think of it, I've never met a lady who stammers all my life.
They are there.
I've met a lot of men, but I've never met a lady who stammers. All right. Is stammering classified, or are there types of stammering?
Yes, there are types of stammering. One, we have developmental stammering. Developmental means hii ulizaliwa nayo. Okay? It's more common in children.
Chances are high, it's either genetic.
Yeah, it could be genetic, ulizaliwa nayo. And there are types. One, there's developmental, meaning this one ulizaliwa nayo, it's inborn. It's more common in children. Secondly, we have neurogenic. You are born, okay, you aren't stammering. Then as you are growing or as you are doing your normal duties, you got a brain injury, may it be traumatic, may it be medical related, you start stammering. Thirdly, psychogenic. There are those people who stammer when they are emotionally disturbed, when they are stressed. That's called psychogenic. So there are 3 categories, if I may repeat and clarify. Developmental, ya kuzaliwa. Neurogenic, acquired. Uliipata along as you grow. Okay?
Because of something. Like meningitis.
Head injuries. Thirdly, psychogenic. Yes.
Psychogenic is now like because of a stress factor.
Emotional imbalances.
All right. That is quite clear. So how does stammering present itself? How would people who are watching us today identify that their kid has this condition? The
presentation can be classified as either to primary presentation or secondary. Primary presentation is the one that I told you as we were starting our conversation. That is the blockage, blocks, repetitions, and prolongation. Secondary behaviors or secondary features, these are behaviors that someone's developed due to the primary features of stuttering. Which are these secondary behaviors? They may present with the eye blinking. Okay, when they want to express themselves, they stamp their foot, they clench their fist, head nodding, word avoidance. They may avoid to use some word or a word because they feel that word would be difficult for them to. So probably they would avoid any word that starts with the letter K, like no, knowledge, because they know it. Depending to that individual. If he feels that a certain word starting with a certain letter or a certain sound is tricky to them, difficulty. He or she will have to avoid it.
All right.
Okay, they may avoid. They may isolate themselves because they feel their confidence is compromised. They shy away from people. They shy away from speaking. They present with low self-esteem. Yes.
All right. So I hope that is clear. We have primary presentations and secondary ones. So primary presentations had already been clarified, and they include things like blockage, right?
Yes.
All right.
Repetition, prolongation.
Yeah. Okay. How do you manage stammering or stuttering?
Since these is not a curative service, they are not drugs that we give.
Yeah.
We manage by doing speech therapy sessions, and they do work. Yes. Speech therapy sessions. It's a rehabilitative service. We rehabilitate.
All right. So speech therapy sessions are done both to children and adults as well?
Yes, both to children and adults.
Okay.
Yes.
Based on what stage they start, and based also on the experience you've had over time, what have you seen work better if they start either at a younger age or as adults?
Of course, early interventions, they give good prognosis.
All right.
Yes. And again, it depends. Any condition, could it be medical, could it be surgical, could it be gynecological, pediatric. Severity of the condition matters a lot.
Yeah.
Age of the patient matters a lot. Yes.
Okay.
The extremities, too young, too old.
And now that you said most parents probably would notice that stammering in their kids at around the age of 2.
Between 2 years to 6 years. But we say the ideal time where we can now say that this child is stammering is around 3.5 years.
All right.
3.5 years.
So if we present a patient today who is 2 years old, would you start therapy at this age?
Once we assess the patient, since this is a long-term thing, we don't rush into management. Okay? We may advise the parent to give the child time. Maybe the child is 2 years. We may tell the parent, come after 6 months, we monitor the progress. Come again after 6 months. So it gives we give some time. Yeah, we don't rush into conclusions. Yes.
What advice would you give to parents who are raising such kids? And also, what advice would you give to individuals, adults who are living with such people who are stammering and probably haven't gone for therapy?
I will advise them, stuttering is not an intellectual deficit condition. Okay? It does not affect their intellectual capacity. Yes. Yeah. They are aware of what they want to say, but they have difficulties in putting it. The brain has difficulty in processing how to put the information. So we should not take these people as if they are intellectually challenged or intellectually inadequate. These are they are normal people. Okay? Yeah. So the challenge whereby they have some challenges in their expression or in their fluency due to those disruptions, they can be worked on, and the person resumes a fluent speech. It's a condition, it's a disorder that can be corrected.
Okay.
Yes.
So that being said, then it means parents with such children should take them to school, and for that matter, a normal school.
They are not special
kids. Not a special.
Yes.
All right.
Yes.
Sawa. Thank you, Daktari, for your time today. Thank you for this conversation. It was impactful, and we look forward to more of such conversations on different topics.
You're welcome.
All right.